Hello and welcome to this Fort Wayne Fire Department short. In this short, we're going to cover CHF, also known as congestive heart failure. In order to do that though, I want to recap the circulatory system and the pathway of blood so that we understand when a failure happens in the pump, well, why is the blood going where it's going? So let's just recap that real quick. So we have a person over here, and that person has tissue that needs to be perfused with oxygenated blood with hemoglobin that has oxygen on it. So once the tissues have been perfused and they've accepted that oxygen, that hemoglobin is going to want to receive more oxygen and it's going to want to offload carbon dioxide. But in order to do all that, it needs to make its way back to the heart. And so we have deoxygenated blood. I have these blue arrows annotating deoxygenated blood, and it's coming from the body into our heart via the right atrium. Once in the right atrium, it's going to descend into our right ventricle, and from there it is going to get pushed via the pulmonary arteries into our lungs, where it reaches its way to the alveolar space and gas exchange can take place. So carbon dioxide can get offloaded and oxygen from the ambient air can be onloaded onto our hemoglobin. Once that exchange has taken place via the pulmonary veins, I have red arrows here annotating oxygenated blood. It's going to come around here and enter the heart via the left atrium. Once in there, it is going to descend into our left ventricle, and then in the left ventricle, it is going to enter the body via the aorta. And so that aorta is going to supply the entire body, and it's going to branch and differentiate into different arterioles and arteries, and it's going to allow tissue to perfuse. So what are we doing when we have a pump problem though? What if one of those pumps, the right ventricle or the left ventricle, fails? What's going to happen? What are we going to do? Well, first let's talk about our right ventricle. When we have right-sided heart failure, that means that I have a pump problem, particularly at this right ventricle. It is not able to pump that deoxygenated blood via the pulmonary arteries into the lungs. And so, as a result, it is going to go back. It's going to go backwards. It's going to backstep the path of least resistance, which is where it came from, which is the body. So these patients are going to present with peripheral edema, most likely, as well as increased heart rate, hyper or hypotension, depending on the stage of congestive heart failure, as well as hypoxia, shortness of breath, and potentially jugular vein distension as well. So what about the other side? Well, if we have left-sided heart failure, that means I have a pump problem in this left ventricle, and it's not able to fully pump blood, some or at all, into our aorta and supply the body with blood. So because of that, it's going to go back from whence it came. It's going to go down the path of least resistance. It's going to backtrack. And where is that? Well, the supply on the left side of the heart comes from the lungs. And so these patients are going to present acutely with pulmonary edema. So what are we doing with these people? What are we going to do for our patients with congestive heart failure? Well, action points are going to be supplemental oxygen. They're going to be positioning. So I do not want these individuals laying supine or really even in like a semi-Fowler position. These people need to be sat upright completely. CPAP and potentially some nitroglycerin. And that is congestive heart failure. Hopefully that was helpful.